One simple movement after meals reduces blood sugar by 52%. A doctor explains how there is a muscle hiding inside your lower leg right now, and most people have never heard its name. It sits deep behind your shin bone, tucked under the bigger calf muscle you can actually see. You cannot spot it in the mirror. Most days, you probably do not even feel it. But this small hidden muscle has a remarkable capability. When it becomes active, it can extract sugar directly out of your blood without your pancreas exerting any effort. A peer-reviewed study from the University of Houston provided concrete data on this. People who activate this muscle while sitting down, yes, sitting, reduce their post-meal blood sugar increase by approximately half. No gym, no diet, no medications, merely a small movement at a desk. And once you understand how it works, you will stop blaming that afternoon energy dip on advancing age or on a substantial meal. Before we get into it, if you want health information explained the way it should be explained, give this video a like and hit subscribe. The goal is 300,000 subscribers, and every like really does push this channel forward. Practical checklist and follow-up posts are available on my Telegram channel. The QR code is on your screen right now, so take a second to scan it. Now let's explore what truly occurs in your body. To understand the post-meal energy slump, you first must understand glucose. Glucose is sugar in its simplest form, and it serves as fuel. This term is significant. Every cell in your body operates using it. Your muscles utilize it, your liver reserves it, and your brain, this is the important part, relies on it nearly entirely. Deprive your brain of glucose for more than a few minutes and you cease clear thought. So glucose is not the adversary. It is a basic, non-negotiable requirement for sustaining life. The problem is never glucose itself. The problem is what happens when too much of it appears in your bloodstream too rapidly and your body has no productive use for it. When you eat carbohydrates, things like bread, rice, pasta, potatoes, anything sweet, and yes, even some fruit, your digestive system converts it all into glucose. The glucose enters your bloodstream. This is normal. This is intended to occur. Difficulties arise when a large amount of glucose enters simultaneously. Imagine a garden hose with a tap turned on gently. Water flows through, the hose holds its shape, everything is fine. Now imagine someone opens that tap fully. The hose bulges, the walls strain. That is approximately what your blood vessels experience during a sudden sugar surge. Your body detects this surge promptly and transmits a signal to your pancreas, a small organ situated behind your stomach. The message is simple: release insulin and release it quickly. Insulin is a hormone, and you can consider it a delivery agent. Its job is to extract glucose from the blood and transport it into cells where it can be utilized or reserved. Some of it goes to your muscles, a lot of it goes to your liver, where it gets stored as glycogen, which is essentially your body's emergency energy store. But here is where it becomes compelling. If your muscles are already fully supplied and your liver is already replete and you are remaining sedentary on the couch after dinner, your body still must process the surplus glucose. It does not just throw it away, it deposits it into your fat cells, and once it goes in there, it is exceptionally difficult to retrieve. Meanwhile, your diligently working insulin has performed its function almost too efficiently. It has moved so much glucose out of your blood that your glucose level declines sometimes below its initial level before you eat. This is the energy dip, and this is where the symptoms millions of people report daily come from. Your blood sugar falls rapidly and your brain, which relies on glucose, becomes alarmed. It issues an alert: energy is running low, address this immediately. A surge of fatigue overtakes you. Your head feels foggy. Your thoughts become sluggish and unclear. Your eyelids feel heavy, and then comes that very specific, almost desperate desire for something sweet at that moment. A cookie, a candy bar, a handful of chocolate from the office kitchen. This is not weakness, and it is not an absence of willpower. It has nothing to do with your character. It is pure chemistry. Your brain is doing exactly what it developed to do, protecting itself from depleting its fuel supply by requesting more. Sugar rose rapidly, sugar fell rapidly, and now your brain is in energy preservation mode. It reduces non-urgent activities so it can maintain vital functions. That is what is really happening when you experience a slump at 3-2 hours in the afternoon. There is a case from clinical practice that illustrates this perfectly. A woman named Linda, approximately 44 years old, works as an accountant, smart, capable, alert in the morning. But every afternoon after lunch, she encounters an energy dip. Her head goes foggy. She cannot concentrate on the numbers in front of her. And reliably, around 3 o'clock, she walks down the hall to the vending machine and buys a chocolate bar. For years, she repeated the same narrative to herself, that she just had a fondness for sweets, that she just lacked self-control. But that was never the truth. Her brain was experiencing the same biochemical process every single afternoon. The chocolate elevated her glucose again, then it declined once more. By 6 in the evening, she felt utterly exhausted, even though her actual workload that day was not out of the ordinary. She was not exhausted from work. She was exhausted from glucose level fluctuations, which had never been clarified for her. And every single one of those fluctuations exact a toll. Every spike forces your pancreas to release additional insulin. Once, twice, 100 times, 1,000 times, over many years, and eventually consequences arise. If any of this is starting to sound like your day, hit the like button. It helps other people who experience this precise pattern find this video. So what are the long-range repercussions? Here is the key point. Your pancreas is not limitless. It has a functional lifespan, and every excessive insulin release gradually diminishes its capacity. At first, it copes effortlessly. Then it becomes less efficient. Then your cells start to disregard the insulin signal. This condition has a name: insulin resistance. Simply put, it means there is plenty of insulin in your blood, but your cells have ceased responding to it. The key is there. The lock is there, but the lock is obstructed. To compel glucose into the cell regardless, your pancreas must produce additional insulin. More and more, year after year, striving with greater effort for diminishing returns. The challenging aspect is that for a long time, your routine blood work can still appear normal. There is no diagnosis, no obvious warning sign, but the fatigue is real. The belly fat is gradually accumulating. The cravings persist relentlessly. You live with all of this for years and cannot identify any specific ailment. It feels too early to consult a doctor because nothing is significantly impaired, but something is amiss. And ironically, this exact moment, when nothing is diagnostically incorrect yet, is the easiest possible time to reverse the trend. Here is another pattern that is frequently observed in primary care. A man named Mike, 52, walks into his doctor's office complaining about back pain. Nothing to do with sugar, right? But during the conversation, he casually states that for approximately 3 years or so, he is constantly hungry, even immediately following a complete meal. An hour later, he is hungry again. The doctor sends him for blood work. His fasting glucose returns at the upper limit of the normal range. Not diabetes, not even officially prediabetes, but to an experienced clinician, that number reveals a narrative. The pancreas is operating close to its capacity. The reserve is shrinking. The only reason nobody had mentioned it before is that documentarily everything appeared technically acceptable. If this entire progression is not halted, insulin resistance eventually advances to prediabetes. Prediabetes progresses to type 2 diabetes. And once you are managing type 2 diabetes, the adverse effects begin to manifest. Damage to your blood vessels, visual impairments, renal issues, poorly healing wounds on your feet. This is not a frightening tale. This is what medical practices in the United States observe on a weekly basis. But here's the good news. While your numbers are still within normal limits, all of this can be halted, decelerated, and frequently ameliorated. And the tool you need is simpler than you think. That tool is your own muscles. Inside every muscle cell, there are minute structures called mitochondria. You do not have to remember the word. What matters is what they do. They function as small furnaces. They extract glucose from your blood, combust it, converting it into energy for movement and heat. While you are remaining entirely sedentary, those furnaces are operating at a minimal level. They need almost no fuel. But the moment a muscle begins to contract, those furnaces intensify their activity. They start metabolizing glucose at a much higher rate. Here is where it becomes particularly noteworthy. Normally, glucose Glucose has to use insulin as a key to access the cell. No insulin, no entry, but an active muscle has an alternative entry point. It opens its own door, no key required. This is a completely separate biological mechanism, and it activates the instant a muscle contracts. Glucose transfers directly from the bloodstream into the muscle cell. Your pancreas does not even need to intervene. Your glucose level declines, your insulin remains stable, the fluctuation cycle never commences. This is why the 90 minutes after a meal are the most crucial period of the day for your metabolism. That is when glucose is rising. That is the exact moment when your muscles can absorb it directly, before it has a chance to be stored away in your fat cells, and before your pancreas has to initiate another substantial insulin secretion. So, which muscle does this job best? That is where the hidden muscle in your calf re-enters the discussion. But first, one quick note. Muscle activity effectively regulates blood sugar, and the scientific consensus confirms this, but it is effective only with consistent practice. One walk after one meal helps that one meal. A daily habit of moving after meals gradually reconfigures how your entire body processes glucose. Your cells become more sensitive to insulin, your muscles become more receptive to glucose. Your entire metabolic function alters. The key principle here is consistency, not intensity. Now the muscle. On the back of your lower leg, just below the knee, there are two main muscles positioned one above the other. The one you can see, the prominence in your calf, is called the gastrocnemius. That is the muscle that contracts when you rise onto your toes. But underneath it, further within the leg, sits a second muscle called the soleus. Most people are unaware of its presence. It does not show in the mirror. You cannot distinctly sense it independently. And yet, comparatively, when it comes to extracting glucose from your bloodstream, no other muscle in your body rivals its efficacy. A few years ago, researchers at the University of Houston conducted an experiment that garnered significant attention within the scientific community. Their study was published in the peer-reviewed journal iScience in the year 2022. They had people sit in a chair and perform a single straightforward movement after eating, raising and dropping their heels while keeping the toes on the floor. You could be working at a computer, watching television, talking on the phone. Nothing about your day needed modification. The only thing moving was the back of your foot. The results astonished even the scientists involved. The post-meal glucose surge decreased by approximately 52%. Insulin release declined by nearly 60%. That second number is substantial. It means the pancreas hardly needed to become involved. The soleus was extracting glucose from the bloodstream so rapidly that a significant insulin reaction was simply unnecessary. You can try this right now while you are watching this video. Plant both feet flat on the floor. Keep your toes pressed down. Now, just lift your heels up slowly and lower them again. Up, down, at your own pace. No rush, no force. You can do this at your desk. You can do it on the couch. You can do it in a coffee shop and no one nearby will even perceive it. 10 to 15 minutes of this after a meal is sufficient to create a tangible, quantifiable impact. The soleus is the most effective individual method, but it is not the only one. The more muscles you engage after a meal, your legs, back, core, and arms, the more glucose exits your bloodstream and the faster it goes. There are a few more options, and all of them integrate into a typical day without requiring specific arrangements. The first is a walk after eating. In one study, 2 groups were provided with an identical meal. One group remained sedentary thereafter. The other group took a 10-minute walk at a leisurely pace. The walking group's glucose peak was approximately half of what the sitting group experienced. We are not talking about an hour on the treadmill. We are not talking about interval training. 10 minutes, easy pace. The route does not matter. You can step outside. You can walk laps around your living room while scrolling your phone. You can climb the stairs in your building a few times. The only rule is to be active rather than sedentary. The second option is squats, and they yield results even more quickly. The reason is simple. Squats activate the largest muscles in your entire body, your thighs, and your glutes. Bigger muscle, more glucose extracted per minute. The technique is straightforward. Stand tall, feet about shoulder width apart, toes pointed slightly outward. Lower yourself down to a comfortable depth. You do not need to hit parallel with the floor. Keep your back straight. Let your knees align with the same direction as your toes, so they do not bend inward excessively. Then push back up. Perform 10 repetitions, slow and controlled. A great trick is to associate it with your kettle. Turn the kettle on for your after-dinner tea, and while it heats up, do your set. That is roughly the right amount of time to allow your glucose to be utilized. And the last tool is the most overlooked of all, housework. People already do it. The problem is they usually do it before they eat or an hour later, once the sugar has already been stored elsewhere. The trick is to do it right after eating. 15 minutes of post-dinner tidying is, in terms of glucose control, approximately comparable to a 10-minute walk. Wash the dishes by hand. You are standing, you are moving. Wipe down the counters, sweep the kitchen floor, put things back where they belong. Your body is moving, your muscles are working, your glucose is being put to good use. You do not even require additional motivation for this because you are going to do it anyway. Here is what I appreciate about these 4 methods. You do not need to restructure your daily routine for them. You do not need to wake up earlier. You do not need a gym membership, which can cost you anywhere from $20 a month to a couple hundred. You do not need workout clothes. You do not need a personal trainer. You just cease being sedentary for 10 or 15 minutes after you eat. Or if you really want to sit, then sit and perform heel raises. That is it. Now there is one pattern here deserving individual emphasis: how fast insulin resistance develops and how fast you can rebuild insulin sensitivity is largely influenced by your age. After 40, muscle mass begins to naturally diminish if you do not proactively preserve it. Doctors call this sarcopenia. Less muscle means a smaller glucose utilization system. A smaller utilization system means more pressure on the pancreas. More pressure means the fluctuation intensity increases. Drop a quick comment below with your age. It really helps me understand who is watching and how relevant this topic is for our audience right now. Let's summarize the findings. In the short term, if you begin activity immediately post-meals, you will perceive the change within a few days. That afternoon, mental cloudiness will fade, your head will feel clearer in the afternoon, your energy will cease plummeting dramatically an hour after eating, and that compelling, intense craving for something sweet will quietly start to diminish its hold. In the long term, you are doing something even more important. You are alleviating the burden on your pancreas. Every time your muscles process glucose directly, your pancreas receives respite. Year after year, those periods of relief accumulate. That is the difference between maintaining metabolic wellness into your 60s and 70s and gradually progressing toward insulin resistance, prediabetes, and type 2 diabetes. So, here are practical steps to consider. Observe closely what you actually do in the first 15 to 20 minutes after a meal. Try those seated heel raises at least once today and see how you feel. It is worth discussing your fasting glucose level with your doctor at your next appointment, and if they deem it appropriate, asking about hemoglobin A1C as well, which is a blood test that indicates your average glucose level over the past 3 months. If you are already on medications like metformin or supplements like berberine or magnesium glycinate that some people take for glucose management, those are essential discussions to conduct with your healthcare provider, not with a YouTube channel. Take what is useful from this video, but consult with someone who knows your complete medical history before implementing any changes. If you got something out of this, drop a like and subscribe. That is what helps this channel keep growing. The goal here is 300,000 subscribers, and every single one of you helps get us closer. For the concise summary version of this video, scan the QR code on your screen. That's my Telegram channel, where the checklists and supplementary materials are located.